Hi, welcome back. It's Dr. Mivi Singh, your specialist here, and today we're going to be looking at how endometriosis is helped and treated by cannabis. So about 5 to 7% of the world's population of females are affected by endometriosis. That's about 176 million females around the world. And as you may not know, endometriosis is where uterine tissue, this is the womb lining, is not just in the womb, but it's deposited in other parts of the pelvic or the abdominal cavity. Then what happens is, during the period known as the menstrual cycle of a female, that then tissue then flares up when the uterus lining is also increasing in size during that menstrual period. And interestingly enough, it often goes undiagnosed, and it can cause a variety of different symptoms and discomforts, such as chronic pelvic pain. It can cause things like fatigue, dysmenorrhea, which is period pain, things like dyspareunia, which is painful sex. It can also cause painful bowel movements, causing gastrointestinal symptoms. And also it can cause pain to pass stool and also pass urine. It can cause anxiety because of these symptoms occurring during different parts of the year, because it's related to the period of the month, and it can also cause things like depression. And as I mentioned, this condition goes undiagnosed for such a long period of time that it can actually take several years, if not decades, for some ladies to actually get the diagnosis. They get blood tests, they get investigations, and these are not just simple investigations like ultrasound scans or MRIs, which don't have any radiation. They can be subjugated to CT scans, which are a lot of radiation. The diagnosis is made by laparoscopy, which is surgery. They do keyhole surgery to look inside the abdomen to see the depositions of the endometriotic tissue. That's a hell of a lot to go through to get that diagnosis. So they get put on a whole host of painkillers, which range from everything from nerve agents like pregabalin, gabapentin, to anti-inflammatories like ibuprofen, diclofenac, naproxen, all the way to things like opioids, so codeine, tramadol, and other types of morphine. So short-acting, long-acting, even fentanyl, buprenorphine patches, the list goes on. And let's not forget the surgical procedure that they have to go through. So that involves a general anesthetic, being on the operating table, being looked at inside by having portholes put onto their abdomen, known as keyhole surgery, and then actually having the little bits of endometriosis charred away. That still does not stop the condition from occurring, and many patients have reoccurrences and relapses and further flare-ups and still require those painkillers. Now when that treatment fails, yes, medical cannabis is there to help. It matches the internal cannabinoid system within the body. And the four most commonest symptoms that medical cannabis works with in these patients is controlling the bowel symptoms, so the abdominal discomfort symptoms that come, bowel motions, and also with the chronic pelvic pain that is caused by the condition. And then the other two features that it helps with is helping with the low mood, so depression, and also with the anxiety. And in the different studies, it's shown that the oral ingestion of medical cannabis is beneficial for the mood disorders that come with it, and actually for the inhaled version, that's more bettering the symptoms for pain because of the rapid onset and the rapid relief. Medical cannabis works through the different compounds that are within the cannabis plant. So that's the cannabinoids, which match the endocannabinoid system that we have within our own body, the THC, and also then the terpenes, which are within the cannabis plant. And as we spoke about before, terpenes act in different ways to help control the different symptoms and features that one is having. But just like everything else out there, like other medical products, medical cannabis is not going to be for everybody, and therefore those patients who meet the criteria should be eligible and they go through a consultation. But then there are also certain side effects that can happen with medical cannabis, and that is why it's important to have a consultation, and that is why clinics exist, to have a consultation with specialists like myself who can then discuss your eligibility criteria, whether it's safe for yourself, what are the side effects, and what to look for moving forwards, and what's the best way to keep you safe and sound. Well, thanks for watching. That's the end of this video. I hope that was informative, and remember, this is not particular individual advice to yourself, it's medical education. Remember to like, share and subscribe, help grow this channel so I can keep making more videos like this to make it more informative. My name is Dr. Mivi Singh. I'm your emergency medicine specialist. Take care and stay blessed. Thanks for watching.